Today, we are diving deep into the biological superhighway that powers your hand. We're going to trace the path of this single vital nerve. Think of it like a power cable, and find out what happens when that critical connection gets broken.
Have you ever really stopped to think about what's going on under the skin when you pick up your coffee, send a text, or feel the difference between, say, silk and sandpaper? What's making all of that magic happen?
Well, it all comes down to one single, incredibly hardworking nerve. It is so fundamental to everything we do with our hands, from building things to creating art, that it's earned the nickname the laborer's nerve. And that is, of course, the median nerve. So, to really get a handle on what happens when things go wrong, we first got to appreciate just how elegantly this biological power cable is designed. So let's trace its path, shall we? Okay, so what is this thing exactly? The median nerve is pretty much the main line for all the fine motor skills and feeling in your hand. It's not just one wire. It's a complex cable that's actually formed by a bundle of nerve roots branching right out of the spinal cord in your neck, specifically from vertebrae C5 all the way down to T1.
And from there, wow, it takes quite a journey. It starts way up in your armpit, or axilla, then it travels down the inner part of your arm, right next to the major brachial artery. It then dives into the forearm, and this is where it gives power to most of the muscles that let you bend your wrist and fingers. And finally, it has to navigate through that famously tight spot at the wrist, the carpal tunnel, to get to its final destination in your hand.
You know, the easiest way to think about this nerve is like a combined power and data line. The motor function, that's the power. It's what drives the muscles, letting you flex your wrist, make a fist, and use your thumb. Then you've got the sensory function, which is the data. It's sending all the information about touch and feeling from your thumb, your index finger, middle finger, and about half of your ring finger, all the way back to your brain. But, like any cable that's run through so many moving parts, it can get damaged. So now let's take a look at the most common places where this system can fail.
So injuries are usually classified based on where they happen. A high injury is one that happens up near the elbow, often from some kind of serious trauma. The big deal here is that it affects the entire nerve from that point down, so it impacts both the forearm and the hand. On the other hand, a low injury happens down at the wrist. Think carpal tunnel syndrome. Here, the damage is much more localized, usually only affecting the muscles that are actually inside the hand itself.
All right, let's start with the high injury. You can basically think of this scenario as a full-blown power outage for everything the median nerve does in the hand and the forearm.
So what does a full outage actually look like? Well, one of the most classic clinical signs is this right here. It's called the pointing index. A doctor will ask the patient to make a fist or clasp their hands together, and this is what happens. The index finger, and sometimes the middle finger too, they just stay straight. They can't bend down with the others.
So, why does it point like that? It's really just pure mechanics. The median nerve is what powers the key muscles that flex your index finger. When you've got a high injury, that power line is cut. The muscles just don't get the signal to contract, and so the fingers simply can't bend. The lights are out.
This exact same paralysis leads to another sign that you'll often hear about, called the benediction hand. When you ask the patient to try and make a fist, that inability to flex the index and middle fingers creates this very distinct shape. It's just another really clear clue pointing to the same underlying problem.
Okay, so let's compare that with a low injury. This is not a complete blackout. Instead, think of it as a more localized issue, like a power failure that's concentrated right inside the hand. The forearm is still getting power.
And the most striking sign of a low injury is this, the ape thumb deformity. Just look at how the thumb has fallen back, so it's lying flat in the same plane as the fingers. It's lost its ability to rotate and face the other digits. That incredible opposable movement that is so central to how we humans use our hands.
So what's happening under the hood here? Well, the median nerve powers these tiny little muscles at the base of your thumb that allow it to lift up and rotate outwards. When those muscles are paralyzed, a muscle powered by a completely different nerve, the ulnar nerve, takes over. It's unopposed. So this competing muscle pulls the thumb inwards, flattening it against the palm and creating that really characteristic appearance.
Now, to confirm this specific weakness, clinicians use this wonderfully simple but really effective diagnostic test. It's called the pen test. The instruction couldn't be more straightforward. You just place your hand flat on a table, palm up. A clinician holds a pen over your thumb, and your job is to try and touch the tip of that pen with your thumb without lifting your palm off the table. A healthy thumb does this no problem, because the abductor pollicis brevis muscle lifts it straight up. But with a low median nerve injury, that muscle is offline. The thumb just can't make the movement. It's a crystal clear sign of paralysis.
So this table really lays out the differences for us. A high palsy up at the elbow, you get the pointing index. A low palsy down at the wrist, you get the ape thumb. Now notice that in both cases, that absolutely crucial thumb opposition is lost. But look at palm sensation. This is a key difference. In a low palsy, the feeling of the palm is actually spared, and you might ask why. It's because the little nerve branch that gives feeling to the palm actually splits off before the main nerve enters the carpal tunnel, so it completely bypasses the site of the injury.